to the edge here. Just thank you very much. So we essentially do the test in scapular plane. Okay? Some people will do it straight up into flexion. Some will do it in scapular plane. Can't remember exactly what your book says. I think they may say into flexion, but you can hit that serratus ANT. Okay, so I personally prefer scaption, just because it is more along the lines of the motion of the serratus anterior. I'll show you an alternative test you might see out in the clinic as well. But according to your book, we're going to bring him, or we're going to have him perform motion, bring him up into about 130 degrees of scaption or flexion, if you will, in scapular plane. And then I'm going to apply my resistance. Where do you think I'm going to apply my resistance? Here? Here?
Depends, do you want to snap his bicep?
Here? Right? Okay. What? I thought there was an answer there. It's going to be just proximal to the elbow, okay? So we're not going to cross the elbow. Because again, it's not that big of a muscle. It's a pretty strong muscle, but it's not that big. And so we can apply just here at the elbow. My other hand, remember, we've always got to have both hands doing something, right? It's not just going to float out there. It's got to be either stabilizing or feeling for something. When we're talking about the serratus anterior, our other hand is going to be kind of doing both. We're going to stabilize, but then we're also going to have our hand on the scapula of the side we're testing. So we're testing his right side. I'm going to place my hand on the scapula of his right side, or his right scap. Okay? And then as I apply my pressure, I tell him, hold it there, don't let me move you. Apply my pressure. Okay? Get my 5 seconds. Good. And what I'm looking for, you can relax now. You can hold it there for a long time. What I'm looking for, or palpating for, with my left hand in this instance, was to see if that scapula would start to wing at all. Okay? For the most part, as a general rule, whenever we're testing scapular muscles and we're palpating the scap, we're hoping that that scapula will not move. Okay? There are a couple of exceptions to that rule, but for the most part, we're palpating the scap. Hopefully it's not going to move. So in this instance, I want to feel it stay nice and tight against his thoracic ribs. If it starts to pop out or we feel that movement occur, then I know that we've got an issue. We're not going to get that 5 out of 5, right? In conjunction, we'll start to see him decrease like we would normally with anything else. Yeah.
So, like, where exactly do you stop them when they're in that motion? Like, you know, do you stop here, you stop here, you stop here?
To apply resistance?
Yeah.
About 130 degrees. Yep. So if I'm 90 degrees right here, there's probably about 120, maybe go a little bit higher, and there's 130. Okay? So 130 degrees within that scapular plane, or within the motion of scaption. That's one way we can do it. Another way that we can do it, I'm going to have you lie sideline. Just like that. And I can take my patient and I'm not as comfortable with this one, but are you okay like that? Yeah. Okay. So I'll keep him at a 90-90 position like that. He's essentially sitting out like this. And then I'm going to palpate on the back with the scapula. I'm going to have him go into protraction as far as he can. So push forward as far as you can. Keep that elbow bent. Hold it. Whoop. Hang on. Hold it right. We're just doing protraction, not going up into upward rotation. Okay. So you just protract as far. There we go. Perfect. And then I'm going to push in towards his body. Again, feeling that scap. It doesn't move. It's not winging. No issues. Okay. So that's an alternative position for it. That one is probably more commonly seen in the clinics, specifically outpatient clinics and things like that. But as far as the book goes, they're going to tell you to do it within the scapular plane at that 130 degrees. Okay? Yes?
So would that be gravity minimal position that you had? Or?
No.
Okay.
No. So when it comes to the scapula, they're really, I don't want to say that. Gravity minimal is tough. There really isn't a gravity minimal position. So for the scapular muscles and motions, we're not necessarily going to have you worry too much about those. For this one, if we absolutely needed to, so I guess going back to the question, yes, it would be, as far as position goes, then yes, that would be gravity minimal position. But again, because we're in that scapular plane, it's tough to get and truly hit gravity minimal position.
So how does grading work?
Yeah.
That's a good question.
Well, you still use the 5 scale, right?
Yeah, so you'll still use the 5 scale.
Does this one have pluses too?
What's that?
Does this one have pluses?
This one does not have pluses or minuses or anything like that. So because your book says that flexion, technically you can do it just in straight flexion and get a grade 2 in that manner or in that way. The issue is that now in that position, are you really testing the scapular muscles or are you testing the flexor muscles, right? And so there really isn't. You just say that it's a weak serratus or a weak rhomboid or a weak whatever muscle there.
And so that's based on the scapula, like whether or not you feel it move and kind of how much
Right.
you feel and stuff.
Right.
Not so much if they can hold their shoulder up while you're resisting it, or
Well, so while they're holding their shoulder, yeah, I'm getting his anterior delt, other muscles and things, but again, I'm palpating that scapula to see if it's moving. Because the scapula could stay there, but maybe he's got weak anterior delt, and that starts to go down even though the scap stays forward. Can happen.
wait. So if they can't hold up that resistance, that's are you still grading?
So then
scapula?
we could do it in the alternative version. Get him on his side, have him go into protraction, and then I apply that resistance. Where now I'm strictly getting scapula,
Okay.
or that serratus anterior.
So when you're getting a low score, like a 1, would it be like you're looking to feel how the scapula moves, or would you be looking for specifically the muscle itself, like moving?
Because of where the serratus lies, it's going to be tough to palpate. You can kind of dig under there and see if you can get a palpation or get any sort of movement. The easiest way would, for like a 1, which this may seem a little weird, but you'll actually get them supine because it allows you to be able to get underneath and get that serratus anterior, and then just have them, you can stabilize their arm and they try and punch up and see if you can get a trace for that one there. So that's a tough one. The scapular motions are tough when it comes to gravity minimal because there really isn't, and then anything really low, it can be tough to palpate.
You can't palpate like where the ribs are, like where it connects to those ribs?
You can, that's why I say, like, he'd have to stabilize, and I'd have to come under here to palpate there.
Okay.
But he's got to have the strength to stabilize. That's why I say you get him in supine. Then all you have to do is help stabilize that arm from falling in a different direction, and you can easily palpate, or
I see.
easier way
I
to
was
palpate the
imagining that
serratus.
incorrectly, so I understand now.
Does everybody get the whole like supine and? Do you want me to show you real quick? Okay. Go and lie supine. Supine, other supine. Here. There we go. So I put him up in this position and I can hold him and stabilize him, but then I'm going to come underneath and I'm going to get through the lats and all sorts of other stuff right up against the rib cage there, and then as he punches up I can feel those serratus muscles pop out. And so even if he's just getting a trace, again, I'm stabilizing him here, go and relax. Stabilizing him here, I come underneath, and then just give me, just even think about the motion. Don't even do the motion. And yeah, he's having a tough time doing just that. But I dig in there and I can feel those serratus pop out.
Okay.
But again, it doesn't require him to do much more than push forward. Okay. Okay. Any other questions with serratus anterior? Yeah.
Just for that first one where you're talking about being in the scapular plane, and is there any verbal cueing to have them